Ovulation diagnosis. So anestrus is 5 months, proestrus is 9 days, estrus is 9 days, and diestrus is 2 months. In anestrus, we can see follicular development. There is a tonic LH and a high steady FSH and a slowly increasing E2. In proestrus, we see Graafian follicle development, so the E2 increases even more until it reaches the E2 peak. In estrus, ovulation occurs 2 days after the E2 peak. We then see a rise of FSH and LH. They surge up very high. And then the corpus luteum also develops, so P4 elevates slowly and then E2 decreases. At diestrus, the corpus luteum is present and the P4 peaks. If the animal is pregnant, the morula enters the uterus. For the ovulation diagnosis, we have 4 pillars: clinical signs, vaginoscopy, vaginal cytology, and the P4 test. For the vaginoscopy, it has to be 45 degrees dorsally for the entrance. In anestrus, there's a small vulva and it's not receptive. The vulva is flat, red, and it seems dry. There's almost no cells. There are parabasal small intermediate cells. They're round, as seen here. And the P4 is less than 1 ng to ml. During this time, E2 is increasing. In proestrus, we see a swollen vulva and bloody discharge. The dog can show increased interest. The vulva is pink and emetous. We can see nucleated superficial cells and red blood cells. The P4 should still be less than 1 ng per ml. And we can see very high E2. The differential diagnosis to very high E2 is remnant ovarian syndrome. In estrus, we see a large swollen vulva. There's less discharge. The appearance seems whitish and wrinkled. We can see large cornified superficial cells. At the LH peak, the P4 is around 2 ng per ml, and at ovulation the P4 is around 5 to 8 ng per ml. On the ultrasound we can see black follicles. In diestrus, the vulva decreases in size.